So last is uncoupler. I told you uncoupler in the beginning only. Uncoupler, what does uncoupler do? There are many uncoupler you can see. So what does uncoupler do? Uncoupler actually, this is mitochondrial membrane. Uncoupler actually creates a pore inside. It is a molecule that will create pore. And this, because of that, this turbine, this all hydrogen has to flow through turbine. This hydrogen will not flow through turbine. So there will not be ATP synthesis, but this hydrogen will flow through this. So if you see this process, oxygen and then NADH, here this electron transport chain happen, electron transport chain, and then ATP production. So if you see here, this electron transport chain is not inhibited, rather ATP synthesis is selectively inhibited. So flow will not be inhibited. There will be flow. There will be flow. Flow will be there. Rather, because ATP is not produced and ATP is inhibitor. So if ATP is not produced, flow will be rather faster. In case of uncoupler, flow faster. The flow of this metabolic pathway will be faster. Flow will be enhanced by this uncoupler. And you know this uncoupler is the molecules that will create bypass of this proton. And why it is called uncoupler? Because this will uncouple. There is two events, oxidation and phosphorylation. So I told you this is tightly coupled. If this does not happen, this will not happen. But this uncoupler will inhibit this, and in place of phosphorylation, heat is produced. And cell does not recognize that it is heat is produced. Heat is not an inhibitor. ATP is inhibitor of this oxidation. So oxidation will increase. And that is why this is called, this will uncouple phosphorylation from oxidation. That is where this name comes from. So if you have understood this, I will go here. So you can see the difference between electron transport. This is very important for NBME also. Difference between electron transport chain and uncoupler. You can see. So electron transport chain is blocking the flow, and that is blocking the whole pathway. Everything is stagnant here. But here nothing is stagnant. Everything is in flow. Only here no ATP production. Here in place of ATP production, heat is produced. That is why malignant hyperthermia, the patient will have malignant hyperthermia and perspiration, sweating. Okay, so malignant hyperthermia you will notice in such condition. Though there is no ATP, in place of ATP there will be heat production. That is what happens. Now lactic acid, because of blockade, lactic acid, you know, because of blockade it will be high. So here you will see normal lactic acid. Oxygen thirst will be increased in both cases, because here what is the reason for oxygen thirst? Oxygen is not utilized, no oxygen consumption. Here increased oxygen consumption. The reason is different, but you will symptomatically you will see the patient breathing very fast. The main difference will be that here the patient will be cold. In case of electron transport chain inhibitor cold, here will be heat, very high heat, malignant hyperthermia. This is a very big difference between uncoupler and electron transport chain inhibitors. So these are the examples of uncoupler. There are natural uncoupler present in the baby. You know, the thermogenin protein. So in newborn, that is why newborn generates heat, because of that thermogenin protein present in brown fat. So this brown fat protein will produce heat normally for children. Only one tissue. All over in other cell there is no uncoupler. So nature has designed the baby with this brown fat so that the baby would produce heat from this uncoupling event. Okay, so these are the inhibitors. You can see uncoupler. Example of uncoupler, just understand, memorize only one example. I don't want to memorize many. If you try to memorize many, you will forget everything. So you understand this 2,4-DNP, dinitrophenol. 2,4-dinitrophenol. You can see this is 2,4-dinitrophenol. So this is phenol dinitrophenol. So this previously it used, actually it was used during Second World War, because the military were becoming thick, fatty. That is why this was used to give to military, so that military will be thin, because glucose oxidation rapid, fat oxidation rapid, carbon dioxide conversion of fat to rapid. There is the flow is rapid. That is why fat will burn very faster. Glucose will burn very faster, and the fat there is present in fat in people will burn very faster. That is why this used to be consumed as slimming drug.